Good evening. Hello, namaste, sat sri akal. I hope everybody is fine. If you can hear me clearly, please type yes. Just to confirm, if you can hear me, please type yes. Okay. If you can hear me clearly, please type yes. Good evening. Hello, namaste. If you can hear me, okay, 54 people have joined.
Yes.
Let's wait for, okay, 121 people have joined so far. Let's wait. If you can hear me, please type yes. I can see that a few of them have typed yes. Okay, so welcome to Diabetes Darbar, and today's Diabetes Darbar will be in English. So if you have any queries, you are most welcome to ask your question. Please be mindful. Please ask your questions only in English. I'll be coming live once again at 8 o'clock for my members. Whoever is the member of this YouTube channel, I'll be coming live once again. Okay, somebody is saying, hello, sir. Can you speak in Hindi? So, this podcast is in English only. So, please be mindful. This podcast is only in Hindi, sorry, in English. If you want to join me for a Hindi session, you are most welcome to join today at 8 p.m. I'll be coming live once again, but that session will only be for the members. So, if you're not a member, please be a member of this channel, and I'll be coming live once again at 8 p.m. and I'll be talking to you live. You can talk to me live over there, face to face. We can have a discussion if you have any queries, and that session will be in Hindi. But this session is going to be only in English. So if you have any question, please ask your question in English. Now let's begin this session. Today we have one more member. You can see we have dietitian Navnita Das. Navanita Das is with us, and she has joined DIAAFIT just 3 days back, and she has 15 years of experience. I would like Navnita to introduce herself, like what she had been doing all these years. So, Navnita, can you please introduce yourself
Good evening,
to all?
all. I hope all are doing good. Good evening, Dr. Anupam. How are you?
I'm perfectly fine.
Okay.
Welcome to
So,
DIAAFIT.
I would like to introduce myself. My name is Navnita Das. I have been working as a nutritionist dietitian for 15 long years, and I was into management as well. So, recently I have joined with Dr. Anupam Ghose as a senior manager at DIAAFIT. So, we look forward for a better health of every individual. Okay, so today's session will be very much interesting. I'll be giving some important and very interesting questions to Dr. Anupam, who will guide you on your health benefits, how to reverse your diabetes. Okay. So,
Okay,
shall we
wonderful.
start now, Dr. Anupam?
Yeah, just before that, I would like to mention that you can see that if you want to join our coaching program, if you have any queries, if you want my consultation, you're most welcome. You can call the two numbers which you can see at which is flashing in the screen. You can
Yes.
call this number. When we will be calling this number, Navnita will be the point of contact. She will answer you if you have any queries regarding uh, the fees and how to join our coaching program. She will guide you. If you want to book a consultation with me, you can call at this number. She will guide you. She will be there. She herself is a dietitian with 15 years of experience. You can ask her any questions. You can ask about our coaching program, and we'll be happy to help you in your diabetes reversal journey. From now on, we will be having an English session mostly because we have got a lot of queries from different parts of the world. Mind you, today we have more than 1 million subscribers, Navnita, and we have followers from different parts of the world. And I have seen that many people don't understand Hindi. Many people don't understand
Yes.
Hindi. They understand English is more common language. So I have decided that we will start this Diabetes Darbar also in English. Diabetes Darbar will also be there in Hindi, but that will be only for the members. So if you're not a member, please click the join button, be a member of this channel, and I'll be coming live again at 8 p.m. And there I'll be having a face-to-face conversation. Okay, sounds great.
Yes.
Okay, any question
So
for me? Did you get any questions from any of the patients, clients?
yes, doctor, I can see a question popping. One of my patient, he's diabetic and he often goes to gym, but he's quite confused. Can he consume whey protein? And after gym, he's feeling quite lethargic. So what do you say? What do you take a call on this?
Okay, so you mean to say he was going to the gym, he was taking whey protein, and recently he has been diagnosed with diabetes.
Yes.
And the question is whether he should continue with gymming and whether should he can take whey protein. This is the
Yes,
question you are
doctor.
saying.
Yes, doctor.
You are saying
Means
that
can
he's feeling lethargic as well. This is the question.
yes, yes. This is the question, and he is asking me, can I discontinue or continue the whey protein? So we'll help him
Okay,
out.
so definitely I'll answer this in a very generic way, but to give more specific answer to his health, there are
Hmm.
certain things which I'm not sure. I don't know. For example, fasting insulin. I don't know what is his fasting insulin level. I don't know what is his HB1C. So as you mentioned that he is diabetic, so I'm assuming that his HB1C will definitely be more than 6.5. As you
Yes.
mentioned that he is feeling lethargic since few days, so I'm also assuming that his insulin level will be extremely high. Okay, whenever you have insulin resistance, your insulin is high, that time you feel very lethargic. Now please understand the science. Okay, why people feel lethargic? Okay, despite eating, despite exercising, because of insulin resistance. Now what is insulin resistance? Insulin resistance is nothing but when your body is producing enough of insulin, but it is unable to work properly. The function of the insulin is to uh, to drive the glucose, to drive the glycogen in your body to the cells. Okay, and because of insulin resistance, because of fat deposition, because of visceral fat, this process is obstructed. This process is obstructed. So as a result, the cells is not getting enough energy. You feel lethargic. Now coming to a question whether he should continue with gymming. Yes, definitely he should continue with gymming, and because if you want to, you know, change the uh, change the insulin resistance to insulin sensitivity, then exercise is very important, and especially strength training is very important, because when you do strength training, you build your muscle. Okay, when you build your muscle, then only your body becomes insulin sensitive. Now when you build your muscle, there is a wear and tear. Wear and tear is there, so there is a damage of your muscle. So when there is a damage, then there has to be repair of your muscle as well. And to repair your muscle, one thing is very important: rest. Along with rest, protein is very important. Sufficient amount of protein needs to be taken. So yes, he can take whey protein definitely, but please understand whey protein is just a supplement. Whey protein is a supplement. It cannot be a meal replacement. Okay. So I don't know what is his body weight, but whatever it is, let me give you a very general answer. First of all, you need to understand the concept of DIAAFIT diet. In DIAAFIT diet, we calculate the total daily energy expenditure. Say, for example, 2000 is your total daily energy expenditure. Out of those 2000 calories, we take um, 26% or below from carbohydrate. And protein is equally important. Protein is the most important, rather. And it constitutes about 1.5 to 2.5 gram per kg body weight. This is what we recommend. So and the remaining calories will be coming from carbohydrate. So if his weight, say, I don't know, do you have any idea what his weight is? Any idea?
Um, he just messaged just now that he will be calling in my number. I'll be a point of contact, so I can share you the details, doctor.
Okay. Anyway, so let's assume his weight is 80. Okay. If his weight is 80, then approximately 120 gram of carbohydrate he needs to take, and up to 2.5. So yeah, and that is 160, 200, up to 200 grams of protein he can consume. Now, if you can consume this much amount of protein from the diet only, then whey protein is not required. Whey protein is only required if he cannot meet his protein requirement from the diet. Okay, that time he can take whey protein. Okay, I hope I have answered the question, and
Yes,
whoever
doctor.
is listening maybe uh, can, you know, take good insight from this. Okay.
Can we move on to the next question?
Yes, yes, sure.
Okay. Doctor, now there's a common trend, no? Most of the people, they are taking bulletproof coffee.
Okay.
So, what is your take on that? That's my question for you because
Okay.
do you think it will help you lower your HB1C and it will help you release your obesity? What all do you take on that?
Okay. So let me tell you, Navnita, that my first video, if you see my first video on YouTube, that was on bulletproof coffee. So if you haven't watched, or any of you haven't watched that video, watch my first video that is on bulletproof coffee. What is bulletproof coffee? It is nothing but coffee with added amount of uh, fat, and fat can come from ghee, 1 or 2 teaspoon tablespoon, or from coconut oil. This is what I recommend. You can take coconut oil, or you can take ghee, uh, that and you add to the coffee, and that is a bulletproof coffee. And now, if you see, bulletproof coffee will have lots of calories, because when you add ghee or, say, coconut oil, it is only fat, right? It is only fat, and 1 gram of fat will have 9 calories, but 1 gram of carbohydrate or 1 gram of protein has only 4 calories. So many people are, sorry, many people are confused that if I take bulletproof coffee, will I gain weight? Will I lose weight? So please understand the concept of weight loss first. Okay. Weight loss happens when you are in a calorie deficit diet, first thing. But calories are not the most important factor. Another factor which is important is insulin. If your body is insulin resistant, no matter how much calorie deficit diet you take, you cannot lose weight. Okay, you have to reduce your insulin level. How can you reduce your insulin level? By following DIAAFIT diet, by exercising, by having proper sleep. So this is very important factor. Okay, now if you understand this concept, then you will know that bulletproof coffee itself will not help you reduce your weight or reverse your diabetes. You need to understand the science. So if anybody is diabetic or has diabetes or overweight, it is because of insulin resistance. If you're overweight, it is because of insulin resistance. If you are diabetic, it is because of insulin resistance. Okay, I'm not talking here of type 1 diabetes, mind you. I'm just talking of overweight or type 2 diabetes patients only. So if you want to reduce your weight, or if you want to reverse your diabetes, then you have to reverse insulin resistance. Okay, now what happens is, when you take bulletproof coffee, although it will have more calories in it because it has fat, but it will bring down your insulin level. It will bring down your insulin level. And how does it happen? It happens because when you take more amount of fat, less amount of carbohydrate, your body releases very less amount of insulin. There will not be insulin spike. It is absolutely opposite of when you consume more amount of carbohydrate. When you take more amount of carbohydrate like roti, chawal, dal, all those things, then your insulin level goes high. But if you take bulletproof coffee, which has more of fat, your insulin level will not go high. It will remain at a very stable position. Okay. So what happens is during that time, one another hormone is released that is called leptin, which gives a signal to your brain that your body is full, your body does not need much energy, and you don't feel so much hungry. You don't feel the hunger. And when you are not hungry, then you don't consume food. When you don't consume so much food, then you are already in calorie deficit. You come in calorie deficit. So as a result, it will help you to lose weight, reverse your diabetes. On the contrary, if you take more amount of carbohydrate, okay, so most of the people, what they eat during their breakfast, mostly cornflakes, oats, dalia, upma, poha, correct? These are high sources of carbohydrate. So when you eat those, your body will release insulin, there will be insulin spike, and then insulin will come down drastically, and then another hormone called ghrelin that is released in your body, and that will give a signal to your body because insulin spike is there, the hormone ghrelin is released, and it will give a signal to your brain, okay, glucose is insufficient, body needs more energy, body needs more glucose, and you will feel more hungry. When you feel more hungry, you will eat more, and when you eat more, so overall you will see eating carbohydrate, although carbohydrate is 1 gram of carbohydrate is equivalent to 4 calories. But you will eat more. As a result, you will consume more calories, and then you will gain weight, and you will not be able to reverse your diabetes. So if you want to reverse your diabetes, you need to consume more amount of fat and protein and less amount of carbohydrate. Okay. And bulletproof will help you to reduce your weight provided you are following DIAAFIT diet and doing strengthening. Okay, I got a very interesting question. Just hold on. I got a very interesting question. Let me take this. Okay, so the one question is diabetes hereditary disease. This is a very, very interesting question. And let me clear this. Most of the people, they think diabetes is a hereditary disease, and they think that it runs in the family. My dad or my parents have diabetes, that's why I got diabetes. Is it the case? No, this is not the case. It is not a hereditary disease. Okay, type 1 is different. Type 1 is also not a hereditary disease. Type 1 is a autoimmune disease, that is different. Diabetes is never a hereditary disease. It can be in very, very rare cases like MODY, MODY, maturity onset diabetes of the young. I'm sure many of you have not heard about MODY. There are 14 different types of MODY, and it is very, very rare. That can be hereditary. But here we are only discussing about type 2 diabetes. Type 2 diabetes is never hereditary. Type 2 diabetes is a lifestyle disorder, and it can only be sorted out, it can only be reversed through lifestyle modification. What is lifestyle modification? You have to change your dietary habits. You have to exercise. You can't live a sedentary life. You have to have a proper sleep. You need to reduce your stress level. You need to drink proper amount of water. You need to increase your NEAT. What is NEAT? Non-exercise activity thermogenesis. So there are so many things you need to make changes, and this is what we teach and we guide in DIAAFIT. Okay, so watch all my videos to if you want to reverse your diabetes, and if you can't reverse your diabetes yourself, don't waste time, because time gone cannot be brought back. Money gone can be earned again. Time gone, You cannot. Health gone, you cannot get it back. So please try to reverse your diabetes as soon as possible. Immediately, I was diabetic 8 years back and I reversed my diabetes immediately within a year. Okay. So if you can't reverse your diabetes just by watching my videos, you should join a coaching program. You must join a coaching program. This below mentioned, you can see there are a few numbers. Call at this number. Dietitian Navnita will help you. Uh, what is the process? How to join our coaching program? What are the fees? And do call if you can't reverse your diabetes. Try yourself first, but don't waste much time. Okay. Okay. Just one more thing. One more thing. One more question. Okay. One more question I got. Can diabetic person go to gym? What could be timing to do exercise if medicine is taken in morning? Please guide. If medicine is taken in the morning, I always recommend for a diabetic patient to do exercise in a fasted state. Do exercise in a fasted state. I always do exercise in a fasted state. I've made a video on that. Please watch that video, because if you take medicine and then go for exercise, you might go into hypoglycemia. To avoid that, do exercise in a fasted state, eat something and then take your medicine. And otherwise, you need to discuss with your healthcare professional how to adjust your medicine. Okay. Okay. Any more question, Navnita? Next question. Any interesting question?
One interesting question is popping up. Mr. Sanjeev wants to know, Doctor, what have you taken for your breakfast? He wants to know
Breakfast.
what you eat for your breakfast.
Breakfast.
Yeah, breakfast and lunch.
Okay. Breakfast and lunch. Okay. So mostly my breakfast, most of the time I skip my breakfast, if you say. Okay. In DIAAFIT, we don't say breakfast, we don't say lunch, and we don't say dinner. We say first meal, second meal, third meal. So most of the time I eat eggs for my breakfast, 3 to 4 eggs, and a bulletproof coffee or just a black coffee. That's my breakfast most of the time. But today I skipped my breakfast, and in fact I had my first meal at around 12 o'clock. That was my first meal. And I can tell you what I had for my first meal. And you can say it as, you can consider this as a lunch. So I had three boiled eggs. Okay. And I had 100 grams of avocado.
Mm.
In avocado, I had taken 1 tablespoon of olive oil and 100 grams of pomegranate. So this was my first meal. You can call it a lunch. Now you can see that I didn't add any roti or rice. I don't eat roti and rice because it is very high in carb and I usually avoid it. Now, what is the logic behind having three eggs and avocado and pomegranate? So it is a complete meal. Okay, when I say complete meal, it has protein, it has carbohydrate, it has fat, it has fiber, it has everything. So it has to be a combination. So once you need to understand the food combination. Let's say, let's take for example, let me break down the nutritional value of each food item. So if you take one egg will have 6 gram of protein and 5 gram of fat, and it 0 gram of carbohydrate. So I have consumed three eggs, which will give me 18 grams of protein, 15 grams of fat. Okay. If I take 100 grams of avocado, that will give me 15 grams of fat and say 8 grams of carbohydrate, and there will be 4 or 5 grams of fiber in it, and 2 grams of protein. If I take uh, pomegranate 100 grams, 15 to 20 grams of carbohydrate will be there, and it will have lots of fiber as well, plus vitamins and minerals. So you can see that it's a great combination. So this is how you need to combine, and this is how we help people, Navnita, in DIAAFIT. Because whoever joins us, whoever joins our coaching program, because you can see that this calculation is quite complex. Many people don't understand. That's why they join our coaching program, and here
Yes.
we guide them. Okay, and you will also be soon or sooner or later you will be doing the same thing. You will be guiding
Yeah.
people
Yeah.
how to make the diet plan and all. This is how we help people whoever joins our coaching program. So if you can't uh, reverse your diabetes yourself, you are most welcome to join our coaching program, and we will help you. We will do the calculation, we will calculate the total daily energy expenditure, we will provide you uh, the details of what you need to eat. So this was just an example. Although I have made lots of videos, hundreds and thousands of people already have reversed their diabetes just by watching my videos. You can also do that. No need of joining our coaching program. But if you can't do it yourself, don't waste time. Please join our coaching program. Okay. Any more question?
Yes. Uh, Generally, uh, Mr. Sudhir is saying that mostly nutritionists, dietitian, they provide a meal gap of 2 hours for a diabetic person. So
Hmm.
since he's into business, so
Hmm.
he has got no time for following the diet chart. So there is a
Hmm.
long gap.
Hmm.
So overall, there is a long gap. So most of the time he's sipping on water or say like coconut water. He don't have time for his meals. So
Hmm.
will it lower his glycemic index or will it be harmful for him? As per DIAAFIT, as per the
Hmm.
other nutritionists, there should be a 2 hours gap, right? So
Hmm.
he just wants to know what do we do. So can you guide him on that?
Okay, so you are saying that he is a busy personal and he takes food after every 5 hours, and uh, because he cannot because he cannot take so many frequent meals, and most of the dietitians and doctors, they recommend frequent meals. This is the question. Have I understood the
Yes,
question
yes.
correctly?
Due to time constraint, he cannot have his equal
Okay,
intervals of
fine.
meals.
Fine. Okay, before I answer that question, I think there's one question popping up. Let me take this question and then I'll come to your question.
Yeah, yeah.
I follow diet diet nearly 1 year. Once my HbA1c came 6.3 from 6.8, but in 1 month before it came 8.4. How I control it? Please, I think you haven't followed DIAAFIT diet properly. Please follow DIAAFIT diet again properly, and you can again control and reverse it. Mind you, if you don't follow DIAAFIT diet lifelong, your sugar level can go high. Now, coming to your question, Navnita,
Mm-hmm.
uh, this is what we recommend in DIAAFIT. Okay, you are not supposed to take 5 6 meals or every meal after every 2 hours. This is not what we recommend. This is the conventional way of treatment. This is the conventional guidance, and we don't follow this. We follow an unconventional way. We say that eat only when you are hungry. Okay, don't eat by looking at your watch. Another frequency of eating needs to be less. It cannot be more than 4 times, 4 episodes of eating. Maximum four, not more than that. 3 to 4 times, 3 to 4 meals. This is what we recommend. So if he's having 3 or 4 meals in a day, and because of his very busy schedule, I think this is the best way to do it. Okay, but he needs to understand the concept of diabetic diet. Whenever he is eating something, there is to be food combination, protein, carbohydrate, and fat has to be as per the DIAAFIT recommendation.
Mm.
Okay.
Yes.
Any other question?
There's a question from Jitendra Patel. Hello, sir. My fasting insulin is 5 and beta cell function is 52.3 and fasting insulin sensitivity is 147.5. My
Hmm.
HB1C is 5.8. What can I do?
Nothing. Follow diabetic diet, exercise. He's not diabetic. It's just in pre-diabetic range.
Yes.
Okay. So there's high chance that he can be diabetic in future. Right now, he is not diabetic. He's pre-diabetic. So he needs to follow the concept of diabetic diet and exercise. That's it.
Okay. Okay. Shall we go with the next question?
Yeah, please. Okay, just one second. One
I
second. One
okay.
second. I think there is one question. Let me take this.
Hmm.
Hi, if I'm doing intermittent fasting from 7 p.m. to 11 p.m. next day, can I go to gym strength training during the fasting period, say around 8 a.m. without having solid foods but only liquid?
Hmm.
Absolutely. Yes, this is what I had been doing. So what happens is, see, you need to understand the concept. If why do I recommend people to go in a fasted state? And why is it important? And why it is beneficial? Okay, so when you exercise, we need energy, right? We need energy. We need energy, and energy comes from glucose, glycogen. But when you are not eating something and doing exercise, so initially your body will consume the glucose which is already present there, but after some time the glucose will get depleted. And when glucose get depleted and there is not enough amount of glucose which is converted to energy, then our body starts breaking fat. Our body starts breaking fat. Okay, and fat is converted into ketones. Fat is converted, fatty acids is converted into ketones, which is another source of energy. So your body will burn fat if you are working out in a fasted state, and your body will be using ketones as energy. So you will never feel drained out or lack of energy. I have been always working out in a fasted state. I go to play golf every morning. I go to play golf every morning, and I don't drink anything, not even water, no coffee, nothing, no liquid, nothing. Mind you, don't when you say liquid, you are allowed only to drink uh, um, which has no calories, like black coffee, black tea, lemon water. But if you are consuming any juice, then you are not in a fasted state. If you are not having solid food but having juice or any kind of other solid thing, liquid things which has calories, then you are not in a fasted state. So please be mindful about that. Okay. Yeah, please go ahead. You can ask now. Any other question?
Can I am diabetic? Can I do fasting on and off? And what sort of diet do you suggest for fasting?
Okay. So that's very interesting question. Many people think that if you're diabetic, you should not be doing fasting. Why? Just we discussed about this sometime back. Dietitian, doctors, they recommend to eat more frequent meal. Don't skip your meals. This is what they say, right?
Yeah. Yes, yes.
So that's why they have a doubt that whether we should do fasting or not if you're diabetic. Definitely, you should be doing fasting. Okay, I had done intermittent fasting for almost a year when I reversed my diabetes. But just doing intermittent fasting will not help you. Okay, let me explain what is intermittent fasting for those people who don't know. Intermittent fasting is nothing but you fast for a certain period of time. You have a window period where during that window period you eat. So there is a eating window period, and there is a another window period where you don't eat. Say for example, I used to follow 16 is to 8. So my last meal is to be at around say 8 o'clock. So 8 to 8 next 8, 9, 10, 11, 12. Yeah, so 8 o'clock I used to have my uh, last meal 8 p.m. and next meal next day I used to have at around 12 p.m. Now this gentleman is also following 7 to 11, right? I think one
Yes.
gentleman is said 7 to 11. Just hold on one second. If you ask one question again and again, you are spamming the comment box. It becomes very difficult for us to read the genuine question. So I'll be banning you. Okay. So please don't ask one question again and again. Don't ask your question in Hindi, please. I've just banned one guy who was just typing one question 100 times. If you type one question 100 times, we are not going to take it. Please be mindful. Ask your question once only. Okay, so I don't know where that question went because of this the spamming. So he asked that 7 to 7 p.m. his last meal and 11 a.m. first meal. So he is also doing almost 16 hours of fasting. Okay,
Hmm.
definitely during the fasting period you can go for exercise, and this is the reason I have explained that your body will break down fat cells to release ketones. Ketones is a good source of energy. Ketones also provides energy. Okay.
Hmm.
Yes. Please ask.
Okay. Do you provide diet for proteinuria?
See, proteinuria is when your kidney is damaged. Understand there is some kind of damage has already been
Hmm.
done. So we have to understand that when your kidney is already damaged, we cannot give you that much amount of protein. We have to restrict protein. Okay, it cannot be 1.5 to 2.5 gram per kg body weight. But yes, if you have proteinuria, you can join our coaching program. We will guide you. Okay, somebody is asking one question. I want to talk with Dr. Ghosh. What is fees and when? Please call this number. Navnita will guide you. Uh, I want to talk with Dr. Ghosh. What is fees and when? Please call at the below mentioned number after this session is over, and she will
Hmm.
guide you regarding the consultation fees and the coaching fees and everything. Okay. Thank you. Okay. Please ask. What is the next question?
Next question is once I join DIAAFIT coach, uh,
Okay.
will it help me on long run, or once I stop following the diet, will it bounce back?
Definitely. If you stop diet, it will bounce back. It is not a one-time diet. It is a lifestyle modification. It is a uh, lifelong process. I am following it for 8 years, and if I don't follow, I'll also be diabetic again. It will bounce back definitely. So please understand. Once you reverse your diabetes, don't think you can stop diet and eat whatever you want or whatever you had been eating earlier. You can continue with the same process. No, this is a lifestyle modification. You have to follow diet lifelong.
Okay. Let me see few more questions.
Okay, one
Can I
question is
have?
coming. Doctor, every
Can
day
I?
I'm having 30 gram atta roti as well as nuts and seeds. So is it okay? As long as you're following diet, you are calculating your total daily energy expenditure and keeping your carbohydrate amount below 26% and having your protein 1.5 to 2.5 gram per kg body weight and the remaining calories coming from healthy fat. As long as you are following that, you can have your atta seeds. Okay, so that's all.
Hmm.
Okay, I got a one very interesting question. Just hold on. Just I got a very interesting question. What is your view on what is a sir? What is a view on fruit only diet? Absolutely bogus. Please don't follow this. Okay, if you're following just fruit only diet, if you're only
Hmm.
eating fruits up to 12 o'clock, eat as many fruits as you want. Please, for God's sake, stop doing this. Many people have come to us after they have damaged their liver, after they have damaged their um, kidney. If you follow the fruit only diet for long period of time, you will have fatty liver. You will have fatty liver 100%. Just follow the fruit only diet because fruit contains fructose, which gets metabolized in the liver. And if you're having more and more of carbohydrate, then this fructose, which is a carbohydrate source, gets converted into fat and is the which causes fatty liver. So please stop it. I have made several videos on this. Please stop eating just fruits. That doesn't mean that I don't recommend fruits, but you can take fruit at a quantified manner, like 100 grams, 200 grams, not more than that. You can't eat as much as you want. No, 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 no. You can't do that. Okay, somebody has written something. My HbA1c dropped from 7.6 to 5.8 in 4 months. Excellent. Follow diet diet. Everybody can reverse their diabetes. Everybody, provided your body is producing insulin. Okay, this is the only diet which is followed worldwide. Every single person can follow, whether you are in India, whether you are in US, whether you are in Australia, America, Japan, anywhere, because this is not a fruit only diet, this is not a meat only diet, this is based on my own research. After reversing my diabetes and 8 years of my research, this is what I have developed this. And it took me long hours of studies and research to come to these conclusions. Okay, nobody has done so much research in this, and this calculation nobody has come till now. This is the one and only calculation in the whole world, and that's why people are able to reverse their diabetes with the help of DIAAFIT diet. Okay. Okay, oh, this guy is saying very interesting. Sir, fatty liver also reversed. Weight down 15 kgs, age 32. Navnita, can you see this? Is it not miracle? Can you see the in the screen? Fatty liver also reversed, weight down 15
Yeah,
kgs.
great.
So what I'm trying to say is eating more fat, healthy fat, reduces weight, reduces fatty liver. Eat more fat and remove your fatty liver, because fatty liver is caused by excess carbohydrate, not because of fat. Okay. Any more question?
I want to gain weight. I am diabetic and increase my metabolism.
Okay, so I've made lots and lots of videos on weight gain. To gain weight, you need to follow DIAAFIT diet. How to follow DIAAFIT diet? Understand the concept of weight gain. Firstly, calculate your total daily energy expenditure and have a caloric surplus diet. Say if your total daily energy expenditure is 2000, then try to consume 2500 calories, and slowly and gradually you will see you will be gaining weight. Okay. Any other question?
Can I visit to your clinic?
Okay, my clinic is in Gurgaon. If you want to visit my clinic, then please call at this number. Navnita will guide you. She will give another
Yes.
number, my clinic number. Call at that number, and then you can book an appointment. At least you will get an appointment after 1 month.
Okay.
Or
One interesting
if
question
you
is
can't
there.
wait for if you can't wait for 1 month, you can take video consultation as well, and you can book your video consultation by calling at the below mentioned number, or at the top here also. If you are looking in a portrait mode, then you can see the number flashing at the top. Okay.
Okay.
Any other question?
One interesting question is there. Can I have malai in the tea?
Malai in the tea. Yes, we recommend malai in the tea. What we don't recommend is Mary biscuit. What we don't recommend is
Yes,
Rask.
yes.
Stop Rask. Stop Mary biscuit, and definitely you can take malai. Malai has saturated fat. Malai has saturated fat. Okay. And many people might think that saturated fat causes heart attack, but it is not. It is the opposite.
Mhm.
It is the opposite. It is the opposite. It is the opposite. Malai has saturated fat. Saturated fat is heart protective. There are a lot of studies. Okay, most of the people, they don't do any research work, and that's why they are not aware of that. Anyway, one guy,
Yes,
what
yes.
he's saying, just okay. Sir, I argued with Eat Foods and Heal guy, and I questioned them as I watch and follow your diet. They showed testimonial that their HbA1c decreased, autoimmune remission, high energy, and whatnot. Okay, see, that's perfectly fine. That's perfectly, just 1 second. That's perfectly fine. Okay, your question. Not everybody is same. Some people will follow food diet and get reversed. That is okay. There are very few people. Okay, maybe 1% of them, and those 1% they will show the testimonial. 99% of the people will not be able to reverse their diabetes, not be able to reverse autoimmune disease, and it is all temporary. It is all temporary. If they continue for 5 to 6 years like that, very soon very soon or later they will have diabetes, they will lose muscle mass. So it is one of the few people who can do it. Okay, I'm not denying that, but all people will reverse their diabetes. It doesn't happen like that. Okay. Okay, so Navnita, any other question?
Okay, so I'm popping one question out here. I'm on insulin dependent. After following your diet, will I be on insulin dependent? And for how long?
Okay, so I don't know whether you are type 1 or diabetes, type 1 or type 2 diabetes. You are saying
Type 2,
insulin
type 2,
dependent.
type
So
2.
if it is type 2, then how can somebody be insulin dependent? Type 2 is already your body is producing enough insulin.
Hmm.
And
Hmm.
if your diagnosis is type 2, then you don't need insulin. Okay. And how do we know that you are type 2? You do a C peptide test. If your C peptide is well within the range, say from 0.8, 0.9 and above, then your body
Hmm.
is producing
Hmm.
enough insulin. You don't need insulin. You can follow diet diet and you can reduce your insulin. But please be mindful when you follow diet and taking insulin, don't stop your insulin immediately. Talk to your doctor first. And if you join our coaching program, then I guide you personally how to reduce, how to tighten your insulin dosage. Because if you stop immediately, then your sugar level might go high, even following diet. So, or it might go down. If you take more insulin, anything can happen. So, you need to be under close observation. So, if you can't join our coaching program or don't want to join our coaching program, you are most welcome to talk to your doctor first. Otherwise, anything can be possible. Okay, but don't stop insulin immediately. I can assure you that if you are type 2 diabetic patient, then you don't need insulin. We can definitely help you stopping your insulin if you join our coaching program. Okay,
Yes,
any more question?
I cannot see any new question. So
Okay,
let
so
me check.
here I'll one question is there. Let me take this serum. My serum creatinine is 1.5. Is it normal or we should take medicine? It's perfectly fine. Nothing to worry. Okay. Sir, I am type 1 diabetic. My HbA1c is 11.7. Can diet diet reduce my HbA1c? Yes, it can. But if you are type 1 diabetic, then HbA1c can be reduced, but diabetes cannot be reversed. Okay. Mm, okay. What else? Any other question?
Will you be on live often?
Yes, we will be live very often now.
Hmm.
Me and Navnita will be coming. We'll be having in English Diabetes Darbar. If you want to join a Hindi Diabetes Darbar, be a member of this channel. And today I'll be coming at 8 p.m. once again. You can join that.
Okay.
Okay.
Anything else, doctor?
Any other question?
No more questions.
Okay. Okay. So they said they have reversed that by only eating fruits. Firstly, they don't understand what is reversal. Ask them whether
Hmm.
they have done glucose tolerance test or not. They don't understand whether their HbA1c is below 5.7 or not, whether they have kept their HbA1c below 5.7 for 1 year or not, whether they have done a GTT test or not, whether their fasting insulin is below 5 or below 6 or not, These are the parameters to decide whether they have reversed or not. Just by saying anybody can come and say diabetes reverse ho gaya. They don't understand what diabetes reversal is. Now uh, somebody will come and say your blood sugar is normal at 250. 250 is a normal blood sugar, okay? So if somebody is having 244 blood sugar, according to him, blood sugar is normal. But for me, it is not normal. It is not normal. It is anything, sugar, anything above 200 is called hyperglycemia. This is the definition. And if anybody tomorrow can come and say normal blood sugar is 300. So if your sugar level, according to their plan, the sugar level will come 280. Oh, we said our definition is 300. If your sugar level is below 300, then you don't have diabetes or you don't have sugar. Okay. So their definition is absolutely wrong. Absolutely wrong. And these people will tell you, अरे वो है ना अमेरिकन एएपी का गाइडलाइन है अरे दे डोंट अंडरस्टैंड आई चैलेंज दैट पर्सन टू कम एंड let we will discuss about that guideline about that american association American Physician Association, I think APA. If they don't understand the guideline, they don't have not read the guideline properly, and they are misguiding the common people, because common people don't understand how to read a paper. They don't understand what is written in the guideline. That person, if he comes to me, I'll explain to him, I'll teach him. I'm a researcher, I've been researching for almost 15-20 years. I'll teach him. He needs to be taught how to read a paper, how to read the guidelines, what is written in that. They are misguiding. Please don't follow this fruit diet and all. I'm telling you. Later on, you will be coming to me only for fatty liver.
Yes.
Okay. Fine.
Okay.
Any other question?
Mhm. Is there any age limit for your diet, following your diet chart?
There is no age limit, but usually after 75, 80, it is very difficult for people to follow the diet. Usually, I recommend if you're below 70, then you can change your lifestyle. After 70, it is very difficult. Okay, somebody is asking charges of coaching, please. So please call at this below mentioned number. Navnita will guide you. Okay, after this call, you can after this session, you can call at this number if you want to know about the coaching program. Please call and then Navnita will guide you. Okay, coaching is not for everybody. Okay,
Yes.
coaching is only for those people who don't have time and who have money. Okay, if you have enough time, then watch all my videos. You don't need my coaching. And if you don't have money and have lot of time, then also you should not be joining. You cannot join my program. So if on you can join my coaching program if you don't have time and you have money, then only you should be joining and you can join. Okay, anything else? Any other questions?
My serum creatinine is 0.43. Is it okay or is it harmful for kidney?
That's okay. Okay, one more question is there. Very interesting question for oral GTT. Why should we have a high carb diet for 4 to 5 days? Okay,
Hmm.
so please understand. This is very interesting question. Why I recommend before going for oral GTT examination or investigation, why should you eat high carb diet for 4 to 5 days? It is because when you take or when you go for oral GTT, it is concentrated glucose. Okay, 75 gram of glucose which you take, which you consume in one go, and it is pure glucose. There is no protein, there is no fiber, there is no uh, vitamins, minerals, antioxidants, or fat. Nothing is there. Why do I recommend 4 to 5 days of a high carbohydrate diet? Because when you take high carbohydrate diet, definitely you'll be taking some amount of protein, some amount of fiber, some amount of fat as well. Okay, you can't just take carbohydrate. So you are taking protein, carbohydrate, and fat. Now, when taking protein, carbohydrate, and fat, then what happens is your if your sugar level goes high, if your sugar is more than 140, then you should not go for the GTT test, because if you're taking protein, carbohydrate, and fat, high carbohydrate and little bit of fat and protein, and still your sugar level is going more than 140, then definitely when you'll go for GTT test, your sugar level will definitely go high. So it is not recommended. So if you're taking 4 days, 5 days of high carbohydrate diet and you can keep your sugar level below 140, that is the time which you should be going for GTT test. Before that, if your sugar level is more than 140, 150, 160, then you should not. It's wastage of time. No use. No use. Okay.
Mm.
Okay. So I hope I have answered your question.
Mm.
Okay. I have one more question. After following DIAAFIT, my HB1C is 5.4 now. Still, I'm following DIAAFIT diet and strength exercise. Follow DIAAFIT diet lifelong and do strength exercise. Your sugar level will never be high. Okay.
How to increase metabolism at DIAAFIT?
To increase metabolism, you need to exercise, have proper sleep, follow DIAAFIT diet properly, and then slowly and gradually your metabolism will be high. Okay. Any other question? Okay. I think it's almost 1 hour
Yeah.
now. It's already, I guess it's almost 7 o'clock, 1 hour now. Thank you so
Yeah.
much. Okay. और क्या है? हमको दोबारा हो गया। Okay, so we will be coming live again, most probably tomorrow. Once again, we will announce the timing. Most probably, I guess 6 to 7. We will try to come live most of the time. We
Mm.
will announce it shortly, and we will have this type of sessions more frequently. Of late, I was not able to come online because of my busy schedule. But now I think I'll be coming, and a lot of queries had been coming that people are
Mm.
not understanding Hindi, whether I'll have any English podcast or not. So yes, from now onwards we will have only podcast in English, not only in English but Hindi as well. But Hindi Diabetes Darbar will be only for the members. So if you're not a member, please be a member of this channel, and you can connect me at 8 p.m. today. If you want a consultation, uh, or join our coaching program, you are most welcome to call below mentioned number, uh, and Navnita will guide you. Okay. Navnita, you are
Is any
mute.
queries? If there is any queries, I'll guide you on that.
Yeah,
Okay.
yeah, yeah. Okay. So thank you, Navnita, for joining
Thank you,
us.
doctor.
Thank you so much. It was a pleasure talking to you and
Same
joining our,
here.
and we will be connected. Thank you all for being connected, and see you at 8 p.m. In a Hindi session. Bye bye.
Thank you. Bye all.